Hello, thank you for joining us for the 49th Annual AAKP National Patient Meeting. We hope you have been enjoying the sessions. My name is Erin Kahle, and I am AAKP's Deputy Director. I have had the absolute honor of being part of AAKP for over 7 years, and over that time, I've been able to work closely with AAKP's Executive Director and Executive Board leadership to stand up AAKP's Center for Patient Engagement and Advocacy and our Center for Patient Research and Education. These centers were founded to serve as a rapid fulfillment hub for requests for kidney patient experts originating from government, academia, medical device manufacturers, and the pharmaceutical industry. Some of these requests include patient representation on technical expert panels, advisory boards, as well as various research and clinical trial initiatives. Since 2020, AAKP has been dedicated to bringing patients a variety of training sessions that provide practical skills they can use to make an impact. To date, AAKP has over 20 skills training sessions, such as being effective with reporters, how to talk to elected officials and staff, maximizing your social media platforms for advocacy purposes, how to be an effective participant in clinical trials, and how to effectively collaborate with researchers and principal investigators in research study opportunities. These sessions are all available on demand and at no charge on our YouTube channel. With that, it is my pleasure to introduce our next advocacy and engagement training session, titled On the Hill, Key Tips for Preparing and Participating in Advocacy Hill Days. This session is proudly sponsored by an educational donation by Bayer. We are excited to host this session as part of our ongoing training efforts to provide you with the practical skills and knowledge to be effective as you engage with elected officials. AAKP's history is steeped in advocacy, with a former board member, Shep Glazer, dialyzing on the floor of Congress to demonstrate the impacts of kidney failure, which supported the passage of the Medicare ESRD program. Since then, for over 50 years, AAKP has been a leading independent voice of kidney patients and a trusted source for federal agencies and elected officials on both sides of the aisle to provide an unbiased perspective on current and emerging legislation. Today's session will equip you with the skills needed to understand best practices in preparing and engaging with elected officials on issues important to you and the kidney community. You'll take away key tips that will help you support AAKP's advocacy work and make the most of in-person and virtual advocacy Hill Days that you may participate in. Today, we are honored to welcome a valued friend, Peggy Tighe. I know you just saw her. We're happy to have her back. Peggy is principal at Powers, Pyles, Sutter, and Verville, PC, and legal counsel for AAKP's longtime allied partner, the American Society of Transplant Surgeons. AAKP has had the pleasure of visiting congressional offices with Peggy over the years, and she is a staple at all AAKP's advocacy and policy events, sharing her professional insight and expertise with kidney patients to support them in being as effective as possible in shaping the policies that impact patients. Peggy, I'll turn the presentation over to you.
And I hope you guys aren't sick of me yet, so if you're still in the room, I guess, or still on the call, I appreciate you being here. So I've done literally thousands of Hill visits, most of them in person, in high heels, on marble floors, which explains why my hips don't work anymore, and lots of them in the last couple of years virtually. So I think I may know a couple things and give you some tips and hints about when you talk to your policymakers in Congress. So what I'm going to do today is give you some training about some key tips on preparing and participating in Hill Days. So Hill Days for you could be, I assume, with AAKP primarily, I hope. Could also be with us, with ASTS. Most recently in our Advocacy Day, we brought in some patient groups, as we have done with AAKP before. I think some of my absolute favorite lobbying moments were lobbying with Paul and Richard. to be honest with you, because we'd do our thing and then we'd go in the hallway and go, that was so fun. Isn't it great when we're on the same page with one another in a Hill visit? So I do cherish that and that relationship. So let's dive in and talk about some of the do's and don'ts, if you will, of lobbying and doing it right. I am a representative of ASTS, right? So transplant surgeons. So folks have asked us over the years, oh, how do you make policy? How do you decide what the transplant surgeons are going to support and not support? This is very, very important. We don't just wing it. We don't just make stuff up as we go along. We have a deliberative body of people who sit down and think this through, and they have different skill sets. There are clinicians, our members, our transplant surgeons. There are lawyers like me. There are policy people like me. And there are experts in policy and the regulatory policy scheme, like my partner, Diane Millman, who works with Powers, and also association folks with ASTS who understand the implications about the policy to our allies. So if you look at this groovy little chart that I threw together, how do we get to ASTS priority? First, if a bill comes to my desk, if you will, I have to ask the question, do we as transplant surgeons, my members, have the right expertise? Are they the right people to weigh in? Should we be weighing in on everything? Probably not. We should probably only be weighing in on things where we have the right expertise and we're speaking for a society of transplant surgeons. Next question, who are you talking to? We better know who we're talking to. Are we talking to policymakers? Are we talking to our own membership? Are we talking to the public? Usually you're talking to all of them. But there's a nuance in how you talk to each of those different audiences depending on the issue. What are we trying to do? What is the plan here? What are you trying to accomplish? We have to think about that in any kind of policy proposal that comes to us. And more importantly, is what's in the middle of this graph is with every decision along this spectrum, if you will, or this circle, if you will, does the policy serve patients? Does it serve the surgeons? Started with patients on purpose, and the broader transplant community by promoting donation and transplantation and supporting continuous improvement. So this is the exercise we go through, and also talking about, is the policy legally sound? In my last presentation, if you were in it, I talked about NOTA, and that is our touchstone. Go to the law and figure out, do we have to change the law? Do we want to change the law? Does the law need changing? Is it the right thing to do to effectuate the goals that we just talked about? And we're always checking in with not only the transplant surgeons, but also with the patients to say, is this sound? Does this policy make any sense? Is it going to hurt you? Is it going to help you? Because ideally, we shouldn't be supporting stuff that's going to hurt patients, right? Then there's the political thing that we have to think through is what would it do for politically, societally, for our own membership? We've got to think that through to protect our own organization to make sure we can be strong in fighting for patients and the surgeons we serve. We also need to know who our allies are and who are not going to be our friends. So this doesn't look all that complicated, but it's a lot more complicated in practice of thinking through all of these different moving parts before we ever decide to put ASTS's name on anything. So I wanted to start with that foundation of where we're coming from because, again, not just winging it. So here's some pics of us at our Hill Day, which was just a couple of weeks ago. And a big part of doing an advocacy day or a Hill Day correctly is to have the right documentation to support what you're asking for. We call it the ask. What is your ask? Are you just going in to say, hey, member of Congress, I hope you care about stuff? Well, you've just wasted a meeting. You should be going into Congress to say, here are our priorities. What are we trying to do here? We're trying to make sure you understand who we are and know our expertise. Were our priorities for this year, the first priority, up on the top right, increase the influence of that particular society. The second thing we were trying to do, and we did in wonderful ways, are gain co-sponsors for a particular bill. That's an ask. That's a discernible and a smart ask. The third was let them know that we support HRSA's OPTN modernization initiative. Reforming the system makes sense. And back to the first priority, we're here to help. We want to help. We want to help guide you in the ways that will make this work. So you have those talking points and make sure the Hill staffers are looking at them. In a virtual environment, it's kind of fun to be able to show on screen, kind of like we are right now, and walk them through what the talking points say. When you're in person, you're physically handing this stuff to people, and they're trying to be polite and not read it if they haven't read it ahead of time. So I suggest sending the paper ahead of time so those staffers at least have the opportunity to have looked at your information before you have a conversation. You don't want to waste the 20 minutes you probably have if you're lucky. It's usually about 15, 20 minutes regurgitating everything that they could have read. The why. Why do you do advocacy? Congress seems to be pretty messed up. It's pretty bad. But guess what? They control a lot of stuff. And in the transplant world and in the patient world and the healthcare world, they control a lot of stuff. And it should be important to us, no matter the state of lack of bipartisanship or whatever else is going on in Congress. We're trying to influence those people we are their constituents. So my members of Congress, my 2 senators, my 1 representative, we want them to know what it is what AAKP or ASTS in our case believes, thinks, and frankly want them to do. We are also amplifying the voices of people who can't be up on Capitol Hill as regularly as we are. We're giving voice to often voiceless people, or just amplifying what they've already said, because we work so closely together with AAKP in devising our own policies. We're also trying to improve public policy writ large. It's important to think about public policy as not just one bill, or not just a couple of bills, or not just one initiative. We have to look at it from that much bigger public policy perspective, because they're parts that have to move interchangeably with one another. And I think what a lot of people make a mistake on is they look at a bill in a silo and say, well, it's just that bill. The staffers, even though most of them are 22 years old, are going to look at you and say, but what about this other thing? What about this other thing? Doesn't this regulation already cover that? The last thing you want to do is walk up to Capitol Hill and say, I have a bill in a silo, I have a bill in this little universe, and get questions asked of you that you haven't thought all the way through in the public policy realm. It's also incredibly important to, as I've mentioned, and I'll say it again till I'm blue in the face, is to make people understand that you can trust them. My profession is not given credit for being the trustworthy profession, which I think is unfair. Because if I am not trustworthy, if I go to Capitol Hill and I lie to people, they're not going to talk to me again. They're not going to talk to you again. If you make stuff up, if you don't know what you're doing, they have an ability, because they're so deluged with other people they're talking to, of maybe putting you off, or maybe not talking to you as in depth as they might have. You have to be on your game. You have to be good. You have to be a resource to these policymakers. Otherwise, they've just had what I call a happy meeting. They've had a happy meeting, check the box with their constituent. They need to know that when they have an issue that comes up on transplant, they trust you and want to come back to you to say, what's your opinion? You're smart. I need to know that person's opinion. That's what you're aiming for in 4 little buckets, in my mind, about why advocacy is so important. So what I've put together, and I'll spend a little time on in the remaining time I have, is a comparison of 2 different bills to show you what I've been trying to teach you about bill analysis, looking at pieces of legislation and thinking through all of those little factors that I've talked about. So I'm taking the Living Donor Protection Act and comparing it to the End Kidney Deaths Act, just so you can see how an analysis goes of those 2 different pieces of legislation. It does not mean that I am opposed or, whatever to the End Kidney Deaths Act. I just need you to see why my society and several others may not be in support of that proposal, because I think it's important to think it through all the way. So, Living Donor Protection Act. I think most of you know by now that it removes financial disincentives to transplant work, which is the Family Medical Leave Act, and insurance coverage, life, supplemental, and disability. We did something together that I will be perpetually proud of with AAKP, is that we went to the Department of Labor in the last administration in a coordinated strategic fashion, and we hit a couple of different angles in doing this. We found what they call a colloquy on the House floor, where members of Congress, when they were passing the Family Medical Leave Act, one of the members of Congress said, hey, could you use this for that thing called organ donation? And the answer on the House floor was yes, that is part of the intention of the Family Medical Leave Act. That's gold in my world. That's called legislative history or legislative intent. It is really strong evidence that the Family Medical Leave Act should protect you in your work, that you should have an ability to use FMLA for organ donation. Prior to the work we did, prior to AAKP and ASTS and AST coming together and really going after this FMLA angle, you could have Googled, and you could Google and say, oh, am I covered with work if I take off time to donate? And the answer was really unclear. You would find a whole bunch of ads from lawyers. No offense to my brethren. Okay, offense to my brethren. That's all you'd find. Since our action, which resulted in a Department of Labor letter, that letter is now public information, and AAKP, I know, shouted it from the rooftops, as did ASTS and others. Now, when you Google, am I covered under FMLA for living donation, you will find a whole different picture. And I'm proud that we did that together. So why do we need to do anything else? It's an opinion letter from the Department of Labor. That's great, but it's merely an opinion letter. I want law. I want something that's going to be really hard to overturn. And that's why we need, for that portion of this bill, to pass that section of the bill. Insurance coverage. I mentioned in my last presentation, if you were in it, that we now have 5 national organizations who are insurance organizations for the first time have completely supported the bill, some of them, and then others have said we won't oppose it. That's a big deal in my world in Congress, because if you have any opposition to a bill, you're likely to have somebody say, let's go do something easier. It's harder to pass something if you know you're going to be attacked by an industry as strong and as powerful as the insurance industry. We don't have that barrier anymore. That just happened in the last couple of months, in the last couple of years, because AAKP and ASTS, meaning me and Paul and Richard and Ed, wrote language to change the LDPA to get to a compromise that did not compromise the values of patients. So this is why I'm so excited the Living Donor Protection Act has a better shot than it's ever had in the last couple of years. End Kidney Deaths Act is, again, I could talk all day about living donor, and I hope I don't have to when it passes into law, because we'll move on to something else. The End Kidney Deaths Act, a very different approach. It's a $10,000 refundable tax credit per year for 5 years. So that would be $50,000 total to living kidney donors who donate their kidneys. And it should say here, to a stranger. It's not to a family member, it's to a stranger. So in a very different approach. So the first one is removing financial disincentives, and the second is providing financial incentives. So I took the time to put this in chart form on the next 3 slides so you can see a compare-contrast of these 2 different bills. So here, Living Donor Protection Act, which would be on your left, is endorsed by all major national, state, and transplant stakeholder groups, and even the insurance industry, as I mentioned. On the other hand, the End Kidney Death Acts, they're trying. They've sent letters all over the place asking for people to support it. But to my knowledge, it is only endorsed by the Coalition to Modify NOTA at this time. Living Donor Protection Act is bipartisan, bicameral. So remember, Republicans and Democrats, House and Senate, has nearly a 20-year history in Congress, only because it's stuck in too many committees of jurisdiction. But it is supported by over 200 House members. Remember how many House members there are? That's almost more than half. That's almost half of all members of the U.S. House of Representatives, and by 42 senators, which is 100. So that's almost half of all members of the Senate. That is how you get a bill moving and passed, is to gain that kind of support. It isn't just us. There's plenty of other groups out there who have been advancing this bill, as I noted above, for many years, which is why we're in the place we're in. By comparison, the End Kidney Deaths Act, it was just introduced for the first time. It is bipartisan, but it only is in one house, and that's the House of Representatives, and it has 4 co-sponsors. Is the clinical literature. This is where the ethics and the policy and the law come in that I've been talking about. Is there have been very serious, very clear analyses, studies, interviews, surveys of people of what would get them to donate. And what people say over and over and over again, who either have donated or might want to donate, is I got to make sure I can keep my job, and I got to make sure I can get insurance going forward. The fact that I gave up a body part should not prevent me from getting insurance and somehow harm my family or harm me going forward. So the clinical evidence is there. The financial incentive for the End Kidney Deaths Act, which isn't as comprehensive as Living Donor Protection Act, is that financial incentive to transplant that I talked about as a refundable tax credit. Those who are arguing for that bill will say it's a demonstration. So it's something that we should be behind because we could just check it out. I'm concerned that the financial incentives are very large and that who is most likely to want to donate, probably people who are poorer and in minority populations. And what the ethicists have said, and it's not just me, but the ethicists have said is first do remove the financial disincentives. We should get to eventually a place where we can have a better conversation about what financial incentives are right or fair, if any at all. There is an unofficial, not official yet, but a zero cost to taxpayers of the Living Donor Protection Act. That's really important, especially in a very fiscally conservative Congress. But however, this bill is assigned to 5 committees of jurisdiction, and that's hard because you got to move the bill out of every one of those committees or get the 1 or 2 or 3 of those committees to say, it's fine, I'll waive jurisdiction and let the bill move. End Kidney Deaths Act, they say, but they have no CBO score, official or otherwise, that it would save money for taxpayers. I don't know that the Congressional Budget Office would see it that way, given that a $50,000 refundable tax credit is a lot of money. So there are 2 committees of jurisdiction in the House, so they're better off on their bill as far as committees of jurisdiction, but there is not yet a Senate companion. So I hope that gave you a sense of how we look at bills and think about legislation. And again, not this is the wrong bill or this is LDPA is the right bill, but just saying, I wanted you to know how our thinking process goes when we think through what should you prioritize? What should we care the most about? In my opinion, it's LDPA. Is advocacy in action is what I'm calling this. And I've talked about this a little bit, so I'll go through these kind of quickly, but you'll have these for your future reference if you need them. Who's your audience? What is the messaging? What are the tools? And how are you repeating those messages? You do realize, those of you who have been to Capitol Hill, that you're probably talking to a 20-year-old, 22-year-old staffer. Many of whom their only experience with the healthcare system is when they were born in a hospital. I mean, God bless them if they're lucky, right? They don't know as much as you know, just by nature of their inexperience. And nobody's faulting them for that. They are important. They also may have that grandmother that Dr. Rush talked about, who they drove back and forth to dialysis. You don't know. They might have an interest in transplantation. And we got to go figure that out. Members of Congress, you can check them out on the website beforehand. Type in transplantation and representative XYZ. You might find out that member of Congress has spoken about it. So do a little homework, figure out who they are. Also recognize who you're speaking to. When you're talking to that 22-year-old, they have an amazing power to talk to that member of Congress and get that member of Congress to listen to them. Do not, as I've seen people have done before, say things like, "You look like my granddaughter." Well, that's a terrible way to speak to somebody if you're trying to treat them like an equal and make them like you. Just one hint. All right, audience is important. Messaging. Starting with the basics, but stopping and asking them, are you interested in transplant policy? Do you know much about this bill? Have you heard about this bill? Those are non-pedantic, non-talking down to people ways of asking them questions without making them feel like they're stupid. The details are going to matter. Those are those talking points that I was mentioning to you before. Also, it's the ask. What do you want them to do about it? What do you want? I see great advocates who come in and they're like, let me tell you my personal story. And it wrenches your heart and you could cry buckets about how horrible that is, what somebody is living through. I respect that. But think about the 22-year-old who's just heard 50 of those stories in the last week. Those stories are going to matter, but what's really going to matter is what you've asked them to do to fix your problem. Have you identified that it's a bill, that it's a letter to an agency, that it's a whatever, an opinion letter you want to get out of an agency to help them help you? Your stories matter, but they've got to be connected to an ask, or honestly, they're just stories. And you may have people who feel for you, but you don't, who cares who feels for you? You want people to do something for you. Tools. Borrow from what's already done. AAKP has beautiful modules and all kinds of stuff on the website. So does ASTS. We also do a lot of joint letters together. We have great documents on living donor protection. We have joint document on OPTN modernization. A lot of this work has already been done. So go find those tools. You also, and I know Erin and others, Diana, have been great in helping you figure out the ways to share your stories. Is it a video? Is it a written story? Where's your comfort level? Do you want to do a video? Ooh, I don't want to do a video, but I write something down. Those are both valuable things. It should be your comfort level of how you can best communicate your story. Just between the speeches, what a beautiful job AAKP has done in enlisting you all to tell your stories on video. I know you're doing a lot of that. Please do more, because in this social media era, that matters. You're not in that Hill office for about 20 minutes, but that staffer is on social media going, hey, wait a minute, let me look up this thing about transplantation or about kidney disease. I just talked to somebody today. You have no idea the amazing impact that you can have working in peer groups, talking to each other like you're doing today, virtually and otherwise, contacting your members of Congress through grassroots software platforms. When you get those messages in your inbox saying, click here, go tell your policymaker, please take that seriously. It really does matter. Also, keeping up to date on what Congress and agencies are doing. Read everything you can so that you're fully informed about the atmosphere, if you will. Because when you're talking to a Hill staffer, you really should know what is going on, certainly in as much transplant as you can know, but also what's influencing them. I was on a call yesterday where the first thing out of my mouth was, oh, is Congress going to be gone today? I heard Congress was on its way out the door. That's all the staffers can think about yesterday. So I acknowledged that. I acknowledged that and said, okay, so here's what I want to talk to you about. And I know this is how much time Congress has left for this piece of legislation, but I'm not ignorant. And I know what it is you can do for me and can't do for me in the time you have allotted going forward. So knowing the politics, and usually Paul or Ed or Richard can guide you on that before you walk into a meeting, could help you not step in something you don't need to step in, and also will show that you're educated and care about where they're coming from. You're not just telling your story, you do actually care, I hope, where they're coming from. That's how you actually influence people, not by beating them up over things that they don't understand. You're teaching them. You're an educator. Ideally, you're an educator and you're showing them a path to fixing a problem that you have that is serious, that is real. And we've identified through our associations, through our policy work, the smart ways to solve problems. And there's no one solution. There's going to be multiple solutions going forward. But knowing that you're part of an independent national association of thousands and thousands of members with reach that is multitude more, that matters to the Hill because your voice is loud. You could give PAC money all day long. It doesn't compare to as loud as AAKP can be. And I mean that in the nicest way. You're getting attention for all the right reasons because you deliver messages that are smart. You deliver messages that are carefully crafted. You think it all the way through. And that's why, again, sorry I say this too much, but that's why I love being partners with you all because you know how it works. Rinse and repeat is what I like to call it. So you did it. You're so proud of yourself. I did my first set of Hill visits and I think I did well and I stumbled on the first meeting, but I got better. You got to do it again and again. And you have to measure it and figure it out. Your grassroots platforms and software will tell you where you're reaching in, where you're talking to people, who's liking you, who is forwarding, who's retweeting, all of that. There's all kinds of new tools that will show you what you're doing and if what you're doing is having the intended impact. How many people are paying attention to your message? Don't repeat messages where people are not paying attention. Try to repeat messages where people are actually paying attention. I know that sounds really simple, but analyze what you've done and improve it with every moment. And use those tools to continue engaging in all the various different ways that you are most comfortable engaging. Written, video, Hill visit, 20-minute phone calls, talking about policy, looking at policy and saying that's not going to work. There's plenty of ways to contribute, and I know you have beautiful opportunities through AAKP to do that. I am done with a couple minutes to spare to take some questions.
We're always learning something new from you, so thank you for joining us, and we appreciate you doing back-to-back sessions. So we do have a few questions for you. Out of all of the great information you just shared with us, what is the top piece of advice you would give someone who has never participated in a congressional meeting before and is nervous?
I can tell you don't. I can tell you don't be, and that's a lot easier said than done. But I'm hearing an echo. Is it bothering other people or just me?
No, you sound good.
Anyway, don't be nervous because it's your story. You own the story. You've done the practice. You've done the homework. And the only really, really, really wrong thing that you can do is talk about campaign funding and money. If you walk into an office and say, I gave your boss $500, I think you should do what I'm asking you to do. Ooh, that is the big no-no. If you do that, you have failed miserably. I'm pretty sure most of you wouldn't do that. That's a bad idea. Anything else you say or do is going to be about not you just speaking, but you listening. If you know this about your own relationships, you know this in interactions with your family. If somebody gets on a soapbox and stops and just speaks at you, you haven't influenced anybody. You should be interacting. You should be listening. You should be responding and doing some back and forth. It is ultimately a real conversation and a relationship builder. What you're trying to do is build a relationship. And I bet you all know how to do that.
Thank you, Peggy. And I know you touched on this, but can you provide more insight on how effective it can be to tie a personal experience or a story to the issue that you're there on Capitol Hill to talk about?
Yeah, I think one of my favorites that I've repeated, even if I wasn't on with AAKP, was when Paul Conway was in one of those meetings with me on Capitol Hill, and somebody asked him, "Well, what are these financial disincentives to transplant? What are you talking about?" And Paul said, "Let me tell you from my own experience. My sisters, here were my sisters' experiences and their stage of life and where they were with business when I needed a kidney, and what they could and couldn't do for me." Right? So he laid all that out, and then he said, if there was a law that said they would be protected, one of my sisters might have been giving me a kidney, and they didn't. And I, of course, made a joke because I'm obnoxious, and I said, it's because your sisters don't like you, ha. But the truth there is that the law changes could impact somebody personally, and in the person of our very own beloved Paul Conway.
Well, thank you so much for your presentation today. We do have one question actually in the audience, so.
Thank you. My name's Sharon Kreitzer, and I'm the founder of a nonprofit donor outreach for veterans. I'm also a kidney donor myself. I really enjoyed your presentation, learned so much, and feel motivated to go out there and advocate, so thank you. And also thank you for the work you've done with the FMLA. I didn't know the history of that, and really applaud that as well. I just have a simple question. Instead of calling something like removing financial disincentives to donation, why can't we just say making donation financially neutral? And that's kind of what I feel, and I believe that your organization helps fund or support NALDAC, which I find to be an incredibly successful program, but is limited. And so why don't we just do simple things first? Why don't we make NALDAC more robust? Why don't we make sure that there's not a connection to who you donate to make sure that that makes you eligible for something, and remove the financial requirements for a donor to get benefits in order to qualify. So I want to applaud NALDAC for all that they've done, and I really want to use my energy to help boost it. And since it's already a program that exists, how can we do that?
So smart. This is why you're so good at what you do, and I've been admiring you and the work you've been doing. So thank you for all that you do. So what people probably don't know right now is that there will be a NILDAC bill coming in the next Congress. So it's something that NILDAC has advised when they were asked by a particular member of Congress, how would you, if you could, if you had the queen for a day, change NILDAC to make it better for people. So there is a bill in the works, kind of sitting there waiting, that I cannot wait to rally the troops to get behind it, because you are absolutely right. Making it financially neutral is where we need to be to start, right? Can we go in the other direction, I suppose, of a modest refundable tax credit? Sure. But first, shouldn't we be working within the current system to make sure there aren't any barriers? I couldn't agree more. And thank you for saying so.
Great. Thank you again, Peggy. We always love having you at our patient meeting. We're glad that you can tune in virtually for us. We want to extend our gratitude for being a wonderful champion to you, for being for the patient community and presenting on the importance of empowering patients and care partners. Can't forget the care partners. Empowering them to make sure they use their voice. Share their insights and lived experience when talking to officials on Capitol Hill.